My name is Amanda Gray, and today I'm going to be talking about my CHNA and Target Evidence Based Intervention Report. Um, so I did mine on the Texas Health Arlington Memorial. Their CHNA was done in 2019, and they've got quite a few members on the report for the CHNA, and I'll read a few of those to you. Um, their mission is to improve the health of the people and communities that they serve. Their vision is partnering with people for a lifetime of health and well being. Texas Health Resources is a faith based nonprofit health system that cares for more patients in North Texas than any other provider. And this report is really good about going over basically all of their community health needs. All of them are primary resources, and they don't have any secondary resources in them. So the main portion of this presentation covers the Tarrant/Parker region of Texas. And Tarrant County is an urban county located in the north central part of Texas, near Fort Worth. The population count is about 2 million citizens, according to the 2018 U.S. Census record, and the population has increased 15.1% since the 2010 census. Their mission is to improve the health of people in the communities that they serve. I know I already said that, but their hospitals and physicians are committed to the well-being and health care of their community. They offer a bunch of different resources such as behavioral health, cancer care, diabetes, digestive, emergency care, ENTs, fitness centers, heart and vascular, hospice care, imaging, all of that. Parker and Tarrant County are right next to each other, and the way that this CHNA report works, or the way that they've conducted this, is actually really neat. They go by zip code, so they can tell like which needs are the highest in which zip codes. And it's kind of neat that they do it that way so that they can kind of count out the ones that aren't in the high need category and then work with the communities that are higher needs. And it's a good way to eliminate the ones that don't need as much help. And let's see. So this is like a 3-year cycle for the CHNA report. It's revisited every 3 years to be updated. So last one was done in 2016. And let's see. Okay, so we've got their data collection process right here. And their data collection process, their starting point is the key priority areas, which are their chronic diseases, behavioral health, awareness, health literacy, and navigation, social determinants of health, and that goes over to prioritizing the zip codes by income, poverty, unemployment, education, occupation, and language, which then goes over to the windshield surveys and the priority zip codes, with built environment, community assets, community leaders, and that goes over to overlay key indicators, which is the public health utilization, non-health care, which is like education, and then key informant interviews, which is their windshield survey informs questions, and then community focus groups, which is their key informant interviews question forms. So that's kind of their interview process, and then their implementation process is when they go through and kind of initiate the people into the kind of areas that they have the higher needs set out for, whether it's in Tarrant or Parker County. And the zip codes that are highest priority get the most care. And in this report, the care that they've kind of discovered that is needed the most without like throughout these counties and in the suburban areas around them are transportation, education, like access to food and housing, and then housing for seniors and like elderly people. And that's where they need the most improvement. So those are their health needs that they've kind of implemented in this report. So they go by zip code and they look through these and they figure out who needs what and where it needs to be implemented. And then I suggested in my paper when I wrote this that maybe reaching out for financial assistance, like financial assistance from the government would be a good idea for these regions that need help, especially with transportation and housing and stuff. and then possibly doing like fundraising in areas that have um, all of the needs that really don't need a lot of work in their zip codes, maybe doing like fundraising in those areas to see if they could raise enough money for the areas that need help. So maybe those would be some good ideas to kind of get them up and going. So those are kind of like the next steps that they could include, because they're kind of vague in this report on like what their next steps are going to be to create a better care system for this community. Um, and then talking about demographics and stuff as well. Let's see. So most of their population is under the age of 18, especially in Tarrant County, and then going on into Parker County. Um, and then, let's see, over 65, there's 14.8% of the population that's over 65 in Parker County, and then 10.5 in Tarrant County. And then for the under 18s, that's 24.7% in Parker County and 26.9% in Tarrant County. So going on to the next demographic, we've got race and ethnicity. And 82.4% of people in Parker County are white and non-Hispanic. And then in Tarrant County, 44.8 of them are white and non-Hispanic. And then they also went ahead and told us like the demographics for language in these counties. And 8.6% in Parker County speak a language other than English at their homes. And in Tarrant County, it's 28.4%. So there's quite a bit of an increase in difference of numbers within the two counties there. And then poverty level was one of the other things that they identified as a health need to kind of get rid of the poverty level. In Parker County, that's 9.2%, and in Tarrant County, that's 13.5%. So I think Tarrant County has a little bit higher numbers in all of these ranges. It's a bigger county. And then the median household income in Parker County is $70,608, and in Tarrant County is $62,532. Let's see. So that kind of covers the demographics. Also, education, people 25 or over with a high school degree or higher in Parker County is 89.4%, and in Tarrant County drops down to 85.4%. So education is definitely kind of a barrier as well here. Let's see. So when we come to talking about challenges in the windshield survey findings, per zip code, Tarrant County has two of them, two zip codes, and then Parker County has one that has needs. So the challenges in the Tarrant County zip code 76010 is tobacco and alcohol advertisements are notable. No grocery store and only small corner stores. Older homes and neighborhoods, little new construction, and few sidewalks and limited spacewalk for safety. Those are their challenges, but their strengths are that they've got 11 identified faith communities, many of which offer Spanish church services, which is really good because they had a higher number of language barrier between households. 8 parks and or open public areas, 2 recreation and 2 senior centers, which of one has a meal program, health and wellness, Texas Behavioral Health, Texas Health Behavior Hospital, and Millwood Hospital. So they do have a lot of resources for hospitals. They've got parks and recreation centers, and they've got faith communities that offer Spanish church services, which is big for this county since there is that language barrier. Also in Tarrant County, the zip code 76119, their challenges are that tobacco and alcohol advertisements are notable. They have limited grocery stores, older apartments, mobile parks, and multifamily dwellings in neighborhoods, and they've got very little new construction, and their sidewalks have limited walking space for safety. Here, their strengths are that they've got 56 identified faith communities that are opportunities for partnership, 12 parks and or open spaces, and 2 community centers with low-cost annual membership. And since the income was a little bit lower in range here in Tarrant County than it was in Parker County, it's a good thing that they've got a low-cost annual membership so people can stay active and healthy. And then in Parker County, zip code 76082, it's a very rural area and resources are available including grocery stores and parks, but centralized. and residents out of town have limited access to it. But their strengths are that they've got 20 identified faith communities, 3 parks or open spaces, 2 senior centers, and health and wellness centers. So they've got a little bit more going on, but they've got a few different weaknesses there. Let's see. Okay. Looking ahead, a total of 41 high need zip codes were initially prioritized across the 5 Texas health regions and will continue to inform the work being done into the future. The purpose of the deeper dive into the 16 community impact zip codes during the CHNA process was to purposefully identify areas of impact where place based programs could be built, grown, and replicated. So here they just kind of talk about how they know that there are these weaknesses and they're going to go by zip code to kind of make sure that they take care of those weaknesses in their communities and make sure everybody can have a healthy future. The conclusion of this report is that the Community Health Needs Assessment for the Tarrant-Parker region utilized a comprehensive set of secondary data indicators to measure the health and quality life needs for Tarrant-Parker region's primary service area and beyond. Furthermore, this assessment was informed by input from knowledgeable and diverse individuals representing the broad interest of the community. Texas Health Resources will interview these priorities more closely during the implementation strategy, development process, and design a plan for addressing these prioritized needs moving forward. And that is all I've got. Thank you for listening.